All right, hello and thank you for joining us. The Southeast Mental Health Technology Transfer Center is pleased to present today's webinar event, Telemental Health During Turbulent Times, Practical Tools to Enhance Your Practice. My name is Emily Moore, and joining me in moderating today's event is Dr. Benjamin Druss, Director of the Southeast Mental Health Technology Transfer Center. Before beginning, I'd like to take a moment to describe the work of our center, followed by an introduction of today's speaker by Dr. Druss. The Southeast Mental Health Technology Transfer Center is located in Atlanta, Georgia, at Emory University's Rollins School of Public Health. We are proud to serve the 8 states of HHS Region 4. Our expertise in public health programs, systems, research, and evaluation provides a unique lens through which we can address mental health priorities. The goal of the Southeast MHTTC is to accelerate the adoption of evidence-based mental health programs by providing training and technical assistance to Region 4. We use a public health approach to build leadership capacity and to provide mental health trainings and resources to providers, agencies, and communities across the Southeast. We encourage you to visit our website to learn more about our center and our upcoming events. I'm now going to hand it over to Ben so that he can introduce today's speaker.
Thanks so much, Emily. Hello, everyone. I'm really pleased to be able to introduce today Dr. Glenda Wrenn. Dr. Wrenn is a psychiatrist, mental health policy expert with a focus on building resilience and advancing mental health equity. She currently serves as Chief Medical Officer of 180 Health Partners, an Associate Professor of Psychiatry at the Morehouse School of Medicine. Dr. Wrenn was the founding director of the Kennedy Satcher Center for Mental Health Equity in the Satcher Health Leadership Institute until 2018. Glenda, it's just wonderful to have you here today, and we're really looking forward to your talk.
Thanks. I am excited to be here. So I think as soon as you guys stop sharing, I'll be able to take over. There we go. All right, so I'm gonna hop right into it. We have a lot of topics to cover and highlight, and then I'm really looking forward to our discussion. I did also have some poll questions throughout the webinar today, so we'll make it really easy for you to participate, and that will help it to be a little bit more interactive. So first, let's just talk about mental health, and we'll start with a discussion around how the current pandemic may have impacted that. So this is the World Health Organization's definition for mental health, which defines it as the successful performance of mental function resulting in productive activities, fulfilling relationships with others. But also the second part, which I will also go into, is that it also includes the ability to adapt to change and successfully cope with adversity. So mental health, globally speaking, is resilience and the capacity to bounce back to adversity, as well as maintaining functional status. So we always have to start with ourselves as providers. So this is the first poll question. How are you currently coping with COVID-19? So we'll do, I think this is going to pop up somehow magically in the Zoom poll, but the choices here: A, I'm barely hanging on, I have pandemic fatigue, and I wish this was over and done with. B, so-so, it's been tough, but I have more good days than bad. C, I've got a new normal, we've settled into a new routine and we're riding it out. Or D, I'm totally rocking it, I've got all my home improvement projects done, I got some new things on my list to kill time. So we'll give you a minute or so to log your choices, and then I think we'll be able to display the results of the group for everyone to see. Okay, so we have a few people that are totally rocking it. That's awesome. We'd love to hear later how you're doing that. we also have a few people on the other end that are barely hanging on. So that's important. We'll talk about burnout. Sounds like most of us are kind of so-so, like just it's been tough, but more good days than bad. And then about a third are kind of settling into new normal. So that's really helpful to kind of know where we're at as a group of, as part of this conversation, and also paying attention to, we do have some extremes that we can maybe learn from a little bit. So there are some unique challenges to mental well-being that everyone is faced with. It's kind of created this global traumatic experience and stressor that we see in ourselves and our families and our friends, and we see in different ways within the people that we care for, our clients and our patients. So here are some of the key challenges that I've identified. The first is increased isolation. Depending on which part of the country you live in, this may be more extreme than others. And for those of you, most of you, I'm guessing, are from the Southeast, where we may have had more looser restrictions in terms of shelter-in-place orders. So there might be like the theoretical freedom to go out and go to the restaurant and go on vacation and go to the beach if you live lucky enough to live in a coastal area. But you may have a self-imposed isolation, or maybe your job has imposed some restrictions. I know in the military, they can't travel more than 75 miles from their base, for example. So there's still, even if you're sort of back to normal, there's still that isolation, and then the isolation from your routines of if you normally got together with people on a regular basis, that might have been really uprooted. And it's the uncertainty around the timing of that that makes it particularly difficult, because if I know I have to ride something out for like a month or two, I can sort of plan and deal with that. But if it's an interminable amount of time, it's hard to kind of manage how much effort you're putting into, and that uncertainty can really wear at us. The difficulty accessing usual supports and services is another unique challenge. People that used to go to social gatherings or had a faith community that was meeting in person regularly, or even had a therapist that they really enjoyed in person, but that person has made a decision to only offer teleservices, and they haven't, gotten over the barriers to engage with those. Or just, this has gotten a little bit better, but for a period of time, ambulatory services were shut down completely, and it took a while for those to come back online. In general, there's an overall difficulty in, hours are being, shifted. Times you used to go to shop, the store might have restricted hours, and that's a challenge. These are all threats to your well-being. Having constrained choices and conflicting guidance are also problematic, because it puts the burden of decision-making on the individual. So, from federal to your state governor to your employer, through the CDC may have 4 different recommendations. Should you wear a face shield? Do you need an N95? How should you manage your risk there? And then in general, like when I want to have the freedom of choice of how I want to go grocery shopping or how I want to plan my workday, those are all constrained. And then additional to that there's the financial insecurity, and this has hit a lot of us in the healthcare sector. Surprisingly, has taken a lot of hits. I've experienced a percentage pay cut across the board that seems to be maybe temporary. I know a lot of colleagues who have had 50% reductions, have lost their jobs, or have been furloughed. So this creates financial stress and insecurity. Is this going to be going on for a long time, a short time? It adds to the stress. And just like we're experiencing this, our patients and clients may be experiencing this, a total loss of work. If you were in the event planning industry, that's been completely wiped out. Whole industries have been like wiped out and put on hold. And then if this is an acute stressor, but if you had a baseline level of chronic stress from a chronic condition or a disability or poverty or financial stress, it's an added layer. And then there's a significant amount of grief and loss. We've had, think we're up to 6 million cases and 100,000 plus lives lost. If you've been personally impacted by coronavirus, you're experiencing that type of grief and loss, but you also may just be experiencing a different type of grief and loss over the loss of your way of life. And then the daily challenge of how are you managing your risk of active, or if you have active infection, and how are you handling that as a family? I have 3 children, I have a teenager, so I've had to navigate his interest in socializing and the fact that my husband works at a hospital and is exposed to COVID positive patients regularly. And I work from home, but I also kind of have social needs. So how do you navigate that all within your family unit to where you can come to an agreement about being comfortable? How do you manage when you feel like you don't have control with a risk that's being brought into your environment? So these are a lot of conversations that need to happen, things to think through, but they all take a lot of time and mental effort. And this is something that none of us had to deal with a year ago. So, and when we have discussion, you may add some here that I didn't list. So these are the main ones that I see consistently within my personal sphere of influence and also clinically. Although I will say that amongst my patients, I've been kind of surprised at how it seems like maybe their existing issues were so significant that coronavirus is just like one more thing. It hasn't really had so much of a dramatic, overwhelming influence. But I also practice in a pretty specific setting, supporting primary care. So it might be that population. I'd be really curious to hear what you're seeing in terms of your patients. So what are some things that we know can help with coping with COVID? The first is really important. That's to just adjust your expectations. So things are not normal. I mean, I just sent my kids back to school. They're doing virtual testing this week. Some of you may also be in that situation where you're working and also a part-time homeschool facilitator if your kids are doing virtual school. So you can't have the same expectations of yourself around keeping the house clean and being super organized. You have to accept that things aren't normal and make adjustments. And it's also important not to have the same expectations of others, to have a little bit more understanding that different people will have different stressors that they're dealing with, and we need to be adjusting those expectations. This gratitude is a really important strength we'll talk about later, but practicing gratitude intentionally is something that can help you to build positive affect. This can be a practice of a gratitude journal or what's called hunt for the good stuff. So your daily reflection at the end of the day, what am I grateful for? What went well? In our home, we also do a roses and thorns. What are some roses from today? What are some thorns? And we support each other around the difficult aspects of our day. We celebrate the positive. So that can be something that you can integrate into your life if you don't already do that. Self-monitoring of mood is key because your mood may fluctuate throughout the day and throughout whatever you're faced with on that day. So checking in with yourself to see, like, what do I need right now? If you're doing primarily virtual work, it's a lot of screen time. It's a lot of intensity and a different level of concentration that's required than if you were in an in-office setting. If you're in a hospital setting or in-office, you're still navigating some changes to your environment. So checking in periodically and say, what do I need right now? Do I need more sleep? Do I need to eat because I've forgotten to do that? And identifying the red flags if you're having a persistent low mood is really key. Related to that is limiting negative exposure, because I think early on there was this kind of desire to get information. So we're like obsessive consumers of news, and then there's conversation. If you're on social media, you may, like me, have floods of conspiracy theorists on one side and hyper concerned others on the other side, and I had to like filter my feed so that I wasn't getting overexposed to some of the negatives on both extremes. And we'll go into this later, but it's not just COVID. There's also social unrest, and all of that can be very overstimulating And if you get drawn into those things, it can take more energy from you than you really want to apply to a situation. So limit it, and be limiting for your family as well. It can help you to kind of create a little bubble of normality and not just have the news on 24/7 or check your alerts all the time. The next tip of advice is about being intentional about your basic needs: exercise, sleep, eat, connect. It seems very simplistic and maybe something like, aren't we all telling that to our patients? Maybe, but I also have seen that it's been something that, providers can tend to maybe not pay that much attention to these things for themselves. How am I sleeping at night? Have I set up my environment so that I can eat and it's not, 3 o'clock and I haven't had anything all day? Do I make time intentionally to connect with people, knowing that I might have to put a little bit more effort into it? And then focusing on what you can control is one of the key aspects of staying functional in times of distress, is to not get lost in all of the things that you can't control. Instead, create that internal sense of locus of control and focusing on that and optimizing that. And then this is related to adjusting your expectations. Have a heaping serving of loving kindness and self-compassion for yourself. If you miss paying a bill on time, if your kids have all, past due assignments from last week despite your best efforts, these things happen. Try not to be so hard on yourself when you're falling short. Have some self-compassion and say, all right, I'm gonna do better tomorrow. And then if you're really, really struggling, maybe some of you that were in that I'm barely hanging on response, seek professional help if you're not already doing it. Don't be afraid to ask for help yourself. Sometimes I think it's just a message that we all need to hear every now and then. And if a trusted other in your life has mentioned that to you, all the more reason to go ahead and take some action. So I mentioned that, coronavirus is one of the huge stressors that we all share, but another thing that has come up concurrently during this time is rising social unrest, primarily driven by police shootings of unarmed Black individuals, and it's raised a host of conversations as well as protests and counter protests and ideas and counter ideas, and it's hard to kind of ignore the fact that this is happening, even if you considered yourself to be not a political person in general. It's just in the air we breathe now. So I felt it would be helpful to share a few points if you hadn't already been exposed to having some language or framework to try to understand at the individual level, which is where a lot of us operate, because this impacts, I'm obviously a person of color. If you are as well, this is impacting you personally. If you're not a person of color, you're also impacted. You have a different perspective and a different set of experiences to bring to that conversation, and that it may be challenging in that way. So you have your colleague interpersonal relationships to reconsider, the systems within you work and play, you may be looking at differently, as well as your patients that are coming in that may be having racial concordance or not your same race, and it may come into the work that you do. So one of the key things that I think is sometimes hard for people to understand or get their heads around is this concept of micro and macroaggressions. And I think I present them here as additional burdens to carry for individuals of color. And I have some examples as well to help give you a sense of it. There's a reference article that summarizes this well I can make available for those of you wanting to read more. Just going to hit the highlights. So what is a racial microaggression? In summary, it's a commonplace verbal or behavioral indignity, and this is whether it's intentional or unintentional. A lot of times it is unintentional, and in fact, sometimes it's even meant with good intentions as a compliment of sorts. But what the problem is that it communicates either hostile, derogatory, or negative racial slight or insult. They are stressful to cope with, and they represent an additional threat to mental well-being. Now pick one example here. You don't act like a normal Black person, And this is one that I have heard a lot in my life. and one that often seems to be communicated as a compliment. And the problem here, the theme of this message is about ascription of intelligence and assigning intelligence to a person on the basis of their race. So if I do well in school and I'm a doctor, it's like, oh, well, that doesn't fit within my idea. You don't really act like, you know, what is in my mind as a normal Black person. The message is that people of color are generally not as intelligent as whites, or it's unusual for someone of your race to be intelligent. Or, you know, this is kind of related to the I don't see color comment that you hear quite a bit these days. Oh, I never see you as a Black girl. The theme here being color blindness. It's a statement that a person doesn't want to acknowledge race, but the message that's conveyed is that it denies a person of color's ethnic experience or denies them as a racial or cultural being. There's many different examples of microaggressions that are out there, and in the discussion, if you so choose, you could share some of them as well as the impact. And then I'd like to distinguish microaggressions from macroaggressions, because these are the things, microaggressions are like, I go into a store and I'm followed around in the store, asked if I need help right away, or I step into an elevator and people move away from me, they feel threatened. Those are microaggressions, but then there are macroaggressions, and that's what we're experiencing, which are large scale or overt aggression towards those of a certain race, culture, or gender. And this is, I think, what is fueling a lot of the conflict and distress, which, depending on the frequency of these events, the intensity of them, and the timing of them, you know, are huge burdens. I know it has affected our family personally, because the things are happening nationally, but then even in our local school district, there were some incidents that were, you know, very traumatic, that was impacting the whole community. There were local protests, and we had to decide what we were going to do about that. So this is happening, and we have to deal with it. And as mental health professionals, we can't act like we're just going to sit here in our office and pretend that this is happening, because it's either impacting you directly or it's impacting the people you serve. So now we're up for our next poll question. Have you personally experienced a racial microaggression? And that's just a simple yes or no. I'll give you maybe 30 seconds or so to respond if you've experienced one of these yourself. I will let you put yes to gender or any other, because it's not, you know, microaggressions can happen with response to race, but also other forms of identity, your sexuality, things like that. So I guess I'll modify the question a bit to say, have you experienced that any type of microaggression based off of your identity status? Yeah, so I've done this question in a couple of groups, and it often will end up this way, that, you know, it's almost like a 50-50. So we have a little bit more of people in this group who have personally experienced a racial microaggression, but a pretty equally significant amount who haven't. So I would say, for those of you that haven't personally experienced this, you know, how is it, what is it like to hear this content? Is it something that you can understand or empathize with if you haven't personally experienced it? That would be something interesting to reflect on. And then next question is a little different, is have you personally been made aware of perpetrating a racial microaggression? This is important because, you know, I know I've done this unintentionally before, and it is very embarrassing, kind of horrifying, especially if you view yourself as a, you know, good person that's not a racist, like all these ways we like to think of ourselves. And then when it's brought to our attention that we've done something that's, you know, violated the dignity of someone else or was experienced as racist, it can, you know, our first response is like defensiveness and then shame and like wanting to kind of push it away. So sometimes you may do this and you're made aware of it. Sometimes you've done it and you haven't been made aware of it, but really curious to see where we fall out in terms of our experience being made aware of perpetrating a racial microaggression. So this is almost it's almost the same split. About a little bit more of the yes, some of the no. Now, there could be two different people in the different groups. So we'll come back to this in our discussion later. Thank you all for participating in the polls. So what are some tips that I can share with you for having these difficult conversations? Because I do think that they are happening more and more, sometimes even in the workplace, depending on what organization you're working with. I know I've been talking with a lot of organizations about how to foster productive conversations within their workplace to think about equity and representation and things like that. But it also may be happening in your personal life, or it may be happening in your clinical life. So no matter what the environment is, always good to first seek to understand, then to be understood. So if I come into a conversation with that posture of, I really want to understand where you're coming from, why you're coming from that direction. I've had many conversations with people that just, they want to talk about class differences, and that class differences are more important than race. And, if it's an authentic conversation, not just like a pointless debate, I'll have that conversation. But it's helpful to understand, okay, you grew up impoverished, you identify as white, you feel that is maybe more of a disadvantage than someone who grew up person of color, and so you're struggling with some of this, what's happening, because it just doesn't feel true to you. So that's helpful for me to understand it from that perspective. The second point is to affirm and validate different experiences, because again, we can't have a productive conversation if I'm coming into it focused on being right, or educating you, or helping you to get woke, whatever it is. Always having that perspective of, I want to affirm and validate the fact that you've had a different experience from me, and that's influencing how you're even hearing information and how you're even hearing me. And then the third point's really key, is that you have to decide if you're ready, willing, and able to engage. And if the answer is no, you don't have to engage in these conversations. May not be the right time, maybe right after something happens, you might need some time to cool off, reflect, decide how you want to engage. If it's someone that's, a subordinate or someone you report to, you may need to think even more about how do you want to broach this topic, if at all. But being intentional about how you engage, and not just reactionary, because often if you're just responding out of your first reaction, you're not giving yourself time to kind of be more in control. And then that's when I think your emotions can start to really escalate, and it can lead to outcomes that you're not intending. And then the fourth point is about investing in your own education and expanded perspective. And this is something really important, because a lot of times people of color feel the burden to educate others about these topics. And, that's not fair. It's same thing around, traditional concepts around cultural competence. It's not the patient's job to explain to you about their culture. You can put some work, if you find that they're, an indigenous Alaska Native, you can do some research on your own and find out about their cultural background. And then you can bring that information to the conversation with curiosity, as opposed to putting the burden on them to explain to you, everything about their culture. So thinking about having cultural humility, and putting some effort into your own education, expanding your perspective, wherever that is, and I think the more that we try to at least understand where other people are coming from, the better chance you have of finding common ground, and also expanding your perspective beyond what you already had. So, all this is going on, and, we're in a work environment most of the time, most of the day, and people say, how you doing? You say, I'm fine, right? This is the same slide. I just flipped it upside down, and now it says, help me. And I use this as my segue to talking about the reality. Well, I guess it's here twice. Someone needed to see that twice. So the reality of our workplace environment, and when we do nothing, when we ignore the stressors that impact those of us working in this area, what is the impact? Well, it leads to burnout, which we'll talk about. It also leads to presenteeism and absenteeism. Presenteeism being that you're at work, but you're ineffective and people wish you weren't there. Or absenteeism, where you're having to take days off, you having to take part days, or you have to take a leave because you've got an illness. So burnout is a psychological syndrome in response to chronic stressors on the job. The 3 dimensions of burnout are emotional exhaustion, cynicism, and detachment, and a sense of ineffectiveness and a lack of accomplishment. So this reduced sense of personal efficacy. The emotional exhaustion is like just feeling completely worn out and just not having the pep in your step. You know, if you are not a naturally cynical person, but you're starting to feel just, you're not feeling it as much, you feel detached or distant, not caring, not as empathy, you know, you have your empathy stores are low, or you just feel like I'm not doing that great of a job anymore. I just don't think I'm any good. I don't think I'm helping anyone. Those are some of the ways in which burnout can manifest. And it actually can be pretty hard to distinguish from depression, especially the emotional exhaustion piece. But one of the tips is that usually burnout is specific to the work context. So you might be fine and effective at home, but it's really at work. I will say that as burnout gets more severe, it will impact all domains of your life, including home. So, but in general, depression tends to pervade all areas of one's life, and it doesn't seem to be driven in any one way in terms of being primarily driven by work. But then most of the time, what happens if you don't do anything about burnout is that it can make you at risk for depression. And then if you are at risk for depression already, you're then more vulnerable to burnout. So there's that overlap with it. And so when you typically hear talks on burnout, they'll probably be framed as like work-life balance talks. And I like to really push against that, because I think the construct of work-life balance is problematic because it kind of assumes that work is always depleting and that non-work or home is always restorative. And that's not always true, because depleters and restorers exist in all areas of life and work. And then that also sets up this impossible model that you're supposed to spend little time as possible at work than at home. And, you know, that if you really enjoy your work and you feel very productive, that's not actually going to help you have a life of meaning and purpose. So the truth is that people really vary in what depletes and restores them. It's important to be mindful on both extremes about being burnt out by work, but also being a workaholic and, you know, ignoring other aspects of your life because you're pouring yourself into work to cope. And then sometimes it's not work, globally speaking, it's a specific job that you have that is just not aligned with yourself and your values and your preferences, and that can lead to burnout as well. And it can be hard to acknowledge and recognize, like, I just need a different job. I need to work for a different person. I need to work for a different organization. You know, I can't just ride it out. Most of us in this health professions, helping fields, have a long wick in our candles of endurance. We can endure a lot. We can sacrifice a lot of ourselves. And so that can be a vulnerability. You might stay in a situation longer than you need to because you're just, you know, you're thinking about your clients. You don't want to let them down. Oh, it's just not always that bad. But if you talk to your loved ones or talk to your trusted colleagues, they may start to recognize this is really starting to undermine like your effectiveness, and maybe it's not a healthy environment for you. So let's come back to that separate construct of resilience that we talked about, which is part of, you know, mental health and well-being. And I like these two pictures because I do like to garden. And when I come home from a hot day and I look at my garden up front, it looks like the picture on the right, where, you know, it's like all wilted, doesn't look like it's going to make it. But if you give that a little bit of a break from the heat and maybe some water, some fertilizer, it'll bounce right back up. That's one form of resilience, the bounce back. Then the one on the left is like a seedling that was planted in an inhospitable setting, but has managed to kind of push itself through and thrive in the face of that adversity. So it's both the ability to grow and thrive in the face of challenges and bounce back from adversity. And resilience is built through a set of core competencies that enable mental toughness, optimal performance, so that ability to function despite threats, as well as goal achievement. There are some important myths and facts, and we've done a lot of research on resilience in adults over time. You know, first we started studying resilience in children, children that were invincible and invulnerable, and that we had this kind of idea in our mind about what resilience was. And now we know a lot more that we've studied it, and we've seen that it's not about never showing emotion, about being steely and tough. It's actually about regulating emotion. That individuals that have difficulty regulating their emotions have a lot of difficulty managing stressors because they're subject to those extremes. And it's not just about the strength of the individual, it's about the individual and relationships, and oftentimes how they leverage relationships to help them to cope or bounce back. It's not about handling everything on your own and being really independent. Asking for help is a really important resilience strategy, to say, I need help with this right now, and knowing when to say that, having the courage to say that. It's really important for resilience. It's not always about acting fast. It's also about knowing when to slow things down so that you can have that better response. And it's not about accomplishing superhuman feats. You know, these extreme examples of someone that grew up under adverse circumstances, those are extremes. But most of resilience is just about the ordinary magic, as they say, of every day bouncing back with real-time resilience in those moments during any given day where you have deterioration of just your energy level and you've got to find your second wind to come back and finish strong. That's resilience. It's not about always being fully composed, because resilience is not always pretty. Sometimes it's pretty messy, and sometimes you have to claw your way out of a difficult situation to get to a positive place. And it's definitely not that you have it or you don't. That's definitely one of those older ideas. Either you're born tough or you're a weakling. That's not true. We know that everyone can develop resilience, and we can train and teach you how to become more resilient. And it's not an endpoint. It's not just an outcome. It's also a process. And a lot of the interventions that you yourself may be trained in teaching others or use yourself, that it's a process that you have to do. So what are some of the things that foster resilience? It's the capacity to make realistic plans and carry them out. Realistic being the key word there, and carrying them out is about taking action on those plans. There's been a lot about positive versus negative outlooks in terms of resilience. So having a positive view of yourself, not overly positive, but accurate, and having confidence in your strengths and abilities. And this is key. You may have heard of the literature around children and parenting, and you know, we used to say your kids, oh, I'm so proud of you, you're such a great person, you're so smart. That sounds nice, but from a resilience perspective, if you took kids that were told that and had them do a difficult math challenge, they actually didn't do as well as the children that were told, like, you're such a hard worker, wow, you really have a lot of perseverance. So encouraging the ability of sticking through to something and working hard versus a more of a character trait about being smart, which then if they're then faced with something that they're struggling with, they don't have the answer right away, well then maybe am I not smart? So that's an example of that. Communication and problem solving skills are also really important to fostering resilience. That's part of how you get to the bounce back part, is being able to communicate what your needs are, negotiate conflicts, and work through them effectively. And then emotion regulation, as I mentioned already, is really important. Managing strong feelings and impulses and being able to regulate them. So much of the research that's been done on this is led by Marty Seligman and the late Chris Peters. In fact, positive psychology emerged as a field to apply the same scientific rigor to the positive dimensions of psychology that was historically applied to illness and pathology. And Marty Seligman was the original researcher that did the learned helplessness studies of the mice, and he's a self-described pessimist. So I find it always interesting that he's then developed a lot of the work around positive psychology. So if you haven't heard about this, you want to learn more, there is a signature strengths questionnaire that you can get for free. You can either Google its values in action is what VIA stands for. So VIA signature strengths, you can Google that, or I have the website link there as well that you can get a free account, take the questionnaire, and it will give you a result of what it'll rank order all the 25 signature strengths. And then there's additional tools and resources there to help you to understand what that is. And I have a couple slides here just to give you a little bit of a primer, but these are the virtues that all of the strengths match onto this: wisdom and knowledge, courage, love and humanity, justice, temperance, spirituality, and transcendence. I also do like using this questionnaire in my clinical practice sometimes because you can't get nothing. So it's really helpful with people that are severely depressed or just have a really negative outlook, because it kind of like, you're going to get some type of strength when they complete the survey. It can help to even help you to see who are they at their best. They may not be presenting that way currently, but it will give you a lens and help to stimulate some conversation. So how do you know that something is a signature strength? You feel true to yourself when you're using it. You can't help but use it. You feel energized when you're motivated internally, and you don't need to be reminded. So for me, one of my top signature strengths is love of learning. And the funny story I'll share about this is, part of the problem is when you have a top strength and like recognizing that other people aren't that way. So I'm always reading like 4 or 5 books at one time. I just love learning new things. And I was supervising a resident in psychotherapy who, after a couple months, was like, Dr. Wrenn, this is the 10th article that you've recommended that I read, and I don't really like to read quite that much. Is there another way that you can kind of give me this information? And I kind of chuckled about it when I realized that I just was acting in a way that would be good for me, but that person had different strengths than I am. But for me, you never have to, motivate me to read a book. You tell me that there's a good book you read, I will buy it that day on Amazon. Like, I just love taking up all different topics, and I feel excited and energized when I read or learn, however I'm learning that. So that's an example of how you know that it's really like who you are at your best. It's effortless, and it's being in flow, to use another term. That's kind of the quality of using your signature strength. Sometimes though, you're in situations that require you to pull on strengths that aren't your signature. And when I do this in groups, we'll often kind of see where everyone has done on the survey. And usually the self-control piece is like, there's a small percentage of the population that's like, self-control is their signature strength. But for most of the rest of us out there, we don't have, it's not our strength, but we often need to call upon self-control and self-regulation, whether that's for diet or not indulging in things. And you can develop your weaker strengths. So we talked earlier about gratitude. That was one when I first did the survey. Gratitude was low. And I was like, I feel grateful. Thanksgiving is like one of my favorite holidays. But it's a values and action survey. So I might value something, but I'm not actually practicing it. And so if you choose, you can develop those weaker strengths through interventions like the gratitude journal, or just being intentional about practicing more of those things. So that's something that you can take some time and fill out the survey, see what your top strengths are. You could also do it in a group with colleagues that you work with and see sometimes there's a disconnect between what my top strength is and what yours is. And by me understanding that like that's you at your best, what I normally would have criticized, I now honor. So the example I like to get for that is my husband, when he did the survey, curiosity is one of his signature strengths. And personally, I always experience that as like really intrusive, because I'm like, he's like always in my business, like asking me questions, till I realized that's him at his best. He's curious, he's not trying to be invasive. He just wants to know like more details about whatever it is. So really seeing people from the perspective of their signature strength can help you to even understand their personality and their behaviors in a different way. So a lot of tips on how you can build resilience. It's about, and these are just some, it's not an exhaustive list, about making connections, about, not getting overwhelmed by a big crisis and seeing it as insurmountable. It's about breaking it down into the small thing that you can take action on. Being flexible in the face of change. is another important care quality. And then taking action towards your goals. So being like functional in the face of adversity, and taking decisive action, looking for opportunities to grow. So being curious. This is all about expansiveness, not being rigid. And so I think especially during these times, thinking about how can I be more expansive and curious and open versus like closing down when everything around me might be forcing me to want to close down. Having a positive view of yourself, putting things in perspective, which is really key, maintaining that optimism and the hopefulness about the future, and then taking care of oneself. So I know I didn't have a chance to, well, I didn't know who was going to be on the webinar, so we didn't do the questionnaire in advance, but I just thought it might be helpful. I think we're going to try to maybe have you all throw this in the Q&A. How are we doing this? Have you answer in the Q&A box. Oh yeah, there you go. Answer in your chat. What is one word that describes you at your best? And then, you know, you can open up the little chat field and scroll through and just see, you know, who you are at your best. And I think it's also a good question to reflect on yourself, because sometimes your best self isn't maybe the one you bring to work often. And that could be insightful too. Maybe I'm at my best, I'm really patient and connected, and I'm thinking about myself as a mother. But you know, maybe when I go to work, I'm bringing a different part of myself, and I could maybe bring some of that strength to the work environment and feel more integrated, I guess. So, all right, last shift, and then I want to hear from you. I'm gonna go quick so I can hear. So, all right, so you know, we've all become telehealth providers. COVID-19 has illuminated problems with lack of parity reimbursement, disparities in access to video technology, the need for telephone-only reimbursement. So we've seen changes because of that. We've also seen that there's been benefits to improved access to care. But on the provider side, there's the risk of focus fatigue. My main point at the end is that it's really not that different from regular in-person care. The evidence base for telehealth, telemental health is very strong. High patient and provider satisfaction, equivalent to in-person care in terms of diagnostic accuracy, treatment effectiveness, quality of care, patient privacy and confidentiality. And it may be preferable for patients that have autism or severe anxiety disorders. And I've seen this in my practice too, where I've been able to get people to ramp up from like not coming to appointments at all, to doing telephone only, to doing video where I'm on video and you're not on video, to then now we're both on video. And then that would not have happened at all if I did not have telehealth as an option. Myself and some colleagues did a study in 2017 looking at Medicaid databases, Medicare claims data over across 28 states to look at telemedicine utilization. What was interesting is that we saw that as a whole, this is telemedicine as a whole, rural white males were more likely to receive telemedicine. And this makes sense because a lot of the policies and incentives were focused on the rural populations. But what was interesting was that nearly 95% of telemedicine claims were associated with behavioral health diagnosis, of which over 50% were bipolar and ADHD. That was an interesting finding. And there was a lot of variation across the states in terms of utilization. So that was 2017. I would expect if we redid that, and that was looking at old data from 2008, right? So if we took some more recent data, it'd be interesting to see how that would change. But even back then, of all the telemedicine, most of those claims are for behavioral health. And for all, whatever your opinions may be about the current administration, telehealth has been a priority for Health and Human Services, in addition to opiates and obesity were the three main priorities that have been the charge of Health and Human Services. And what we've seen is that we see coverage from private payers, Medicaid and Medicare. Here's some data there. The VA has done a lot to invest in telehealth, and so they used to start with like clinic to clinic, where the patient had to come to the clinic. Now we're seeing way more common in-home. So the VA invested a lot in home-based, so the patient can be at home. They can have their caretaker also come into the doctor's visit. The doctor can be also at a different location. And we do see that not all, but we are seeing the private payers start to improve in terms of payment parity. That's another thing you had to be tricky on. They may allow you to use the same codes for telehealth, but they might change the reimbursement. And Medicaid, I've seen a lot of variation in that with some of the across states, but you also see variation across private payers. But Medicare has also come up because before they weren't allowing, they weren't reimbursing e-visits and virtual check-ins with parity, and some of that has changed during the pandemic. So these are all positive things. Some final thoughts around guidelines and tips. Confidentiality is important, bidirectional. So we often think about our technology that we use, but we might not think about where the patient is. So it's key to know like where the patient is and are they in a confidential space, and educating them about how to ensure their confidentiality from their side. In my note, it's always important to document and consent, even though you might have a global consent form. I always just put it in my note that we conducted a virtual visit and they consented to that, and then confirm the location of the patient before you get started in case there's a safety issue that comes up later in the session, that you can identify where they are. On your end, pay attention to lighting and setup. You don't want to have, you know, yourself as the shadow. If you have a window behind you, that's not good lighting. You want the light to face you. Make sure your audio connection, if you have variable internet hookups, then you need to connect through a landline or a phone line and not use your computer connection. Get a good speaker that works well. If you don't have environmental control from that perspective, from confidentiality, you may need to use headsets. So there's all these types of things that can improve the experience for both sides. I use a split screen so that I can have the camera and I can see the video on one side, and then I can document at the same time. If I use this screen, you can tell I'm not looking at you. So like playing around so that you can stay engaged as well as get your documentation completed in the same time is really important. And then physical comfort, we don't think about that, but if you're not comfortable where you are physically and you're in a screen where every movement that you do is exaggerated in a way that if you were in the room isn't, you can get like really uncomfortable physically. So experimenting with your physical setup, being compassionate with yourself about how you schedule. You may think, oh, I just go back to back to back. Give yourself breaks, just like if you were doing in-office care. And then the eye strain is really important. Some people like to use blue light filter glasses if they have that many hours on the screen, or even just taking breaks and going outside periodically through the day can be really helpful. So here's like my one check on learning question that I have for you, the last question. All the following are reasons for poor adoption of telemedicine, except lack of access to broadband internet access or necessary equipment. Patients and providers in general do not connect well virtually. Lack of parity for reimbursement of telehealth versus in-office. The current administration has not supported telehealth. So you're going to find the one thing that's not true, and that will be your answer. I'll give you a few seconds to weigh in there. Okay. A lot of variation here. Okay, so the correct answer is B, because we have evidence that patients and providers do connect well on, so that one is actually true. I'm wondering why there's so much variation here. Maybe I need to rewrite this question. So it's false that the current administration has not supported telehealth, because remember I said it's one of the priorities. And we do see reimbursement for telehealth in a lot of places, although, you know, does that impact adoption? I can maybe give you credit there, the 10 of you that said yes to that. And lack of access to broadband does interfere with adoption of telehealth, so that one's true. All right, well, that was interesting. I think we have time to do our Q&A, so let's move into the Q&A. I'll stop sharing and see what you guys are interested in talking about.
Yeah, thanks so much, Dr. Wrenn. Let me get to our Q&A screen. All right. Okay. So everyone, we've now reached the last bit of our webinar. We have a few minutes left over for Q&A. So any of you that have questions, please type them into that Q&A section at either the bottom or the top of your screen. It actually says Q&A. Please try to avoid entering your questions into the chat just so that it's easier for us to keep up with all of your questions coming in. I'm going to read questions in the order that they're submitted for Dr. Wrenn. So Dr. Wrenn, our first question that we had entered before your presentation ended was, have you ever been involved in doing procedure-related cost analyses that can lead to cost containment, enhanced reimbursements from Medicare, Medicaid, and private insurance entities?
So, and I saw the follow-up question where it's about
Yes.
there's a form that one could use. I would need to probably know a little bit more about this question. I will say that the company that I'm with is a values-based organization, so we do have a pretty robust way of estimating the value of the services that we deliver and also tying that to clinical outcomes and routing that back to our conversations around reimbursement. That's how we actually negotiate case rate and provider reimbursement rates. And even as an individual provider, you can negotiate your rate with a health plan. So if you are in private practice or something like that, you might think you just have to take the rate that's offered to you. You can always negotiate for more. So that individual, I'm maybe thinking they may want to offer that to the group. That would be great.
Wonderful, thanks. Our next question, what ways do you think are best to engage the SPMI population? What about those of low SES?
So this is a general question. I can't tell if it's general or in the context of COVID or racial unrest. I think that engagement is a really important topic. I think that, in general, it depends on how you practice. I mean, I've always cared a lot about engagement. So it's been important to me to make sure I understand what a person's experience is, what are some of their barriers to engaging with care and trying to anticipate that. So for example, if you have someone who has schizophrenia and they have some distrust, maybe they have an extreme amount of distrust for certain technologies. And being flexible and willing to work with them within their current comfort zone and then progressing from there, I think is one example of an engagement strategy. So, okay, let's just meet by telephone. Or if that person really feels strongly that they need to have in person, and if I can't provide that, helping them get to a place where they can get the care that they can engage with, as opposed to trying to have them conform to my way of engaging. For low SES, I think it's similar, just understanding what are some of those barriers to engaging in care and trying to eliminate them as much as possible. But also just to be curious about what their experience is and how much, maybe things outside of their diagnosis may be impacting how they are experiencing their condition and working with you.
All right, thank you. Our next question, do you find that during this time, racial comments are taken more harshly?
Yeah, I mean, I think during this time, there's been a lot more racial commentary happening in different domains. And it also could be equally true that we may hear things differently. So, I experienced race-based comments to the provider long before there was social unrest. People refusing to have me care for them, people making comments or questions or things like that, I've had to deal with this for quite a long time. So it's not really different for me from the clinical care perspective. But I have seen more in my social life where there's a lot of discomfort around having conversations around race, where it's viewed as it's still a very sensitive subject for a lot of people. And then I think particularly in the work environment, as people are feeling more empowered to stimulate conversation, it's not always met with a welcoming response. It may be viewed as inflammatory or provocative, for example. So that's why I talk a lot about having those difficult conversations and being intentional about, it's almost like creating a safe environment to have a productive conversation as opposed to just an argument and getting dismissed.
Wonderful, thank you. I think this is going to be our last question of the afternoon. What are some of your tips for keeping preteens engaged in telehealth services?
So that's a really interesting question. I guess it depends on how far preteen you mean, because you know, I've got several preteens. I'm an adult psychiatrist, so I'm very limited in how I'm going to answer this question. But I will say, from my personal experience, you know, my kids are I have an 8 and 10-year-old as well. They're very comfortable with technology and can stay pretty engaged through the technology. I also supervise a practice that sees a lot of child and adolescents, and the therapists there have used other techniques, used other like virtual ways of playing a game virtually and then connecting visually. So it's like doing play therapy virtually. You can't be in the room to use other devices, but you could, you know, use another type of interactive tool to play together virtually, in addition to the face-to-face component of virtual. But I think that's the key. You can't just expect they're going to sit there and talk the whole time is the main thing. So having some activity, even if it's just a piece of paper, oh, draw something, let me show you what I draw, can you see it? That type of thing I think is important for keeping folks engaged in a way that maybe with adults you could just have them ask, you know, your traditional, it's not that much different how I practice with adults in person.
Awesome. Thank you so much for that, Dr. Wrenn. I think that's about all the time that we have for Q&A this afternoon as we're wrapping up here. Do you have any final comments or questions that you want to provide to our participants before we move on to the evaluation?
No, I just am really grateful to have been a part of it. I hope it was helpful and interesting for you all, and thank you all for joining.
Wonderful, thank you. All right, everyone, that is going to conclude today's presentation. The Southeast MHTTC would like to thank you for your participation in today's event. We value your feedback and invite you to evaluate this event by completing a brief SAMHSA required survey. You can complete the survey by visiting the link presented on your screen or by scanning the QR code to the right. Afterwards, you will automatically be redirected to additional questions from the Southeast MHTTC regarding the impact of today's event on your knowledge and skills. There, you will also have the opportunity to download a certificate of attendance for your records. Please allow about 5 to 10 seconds for your browser to redirect you. Again, our center appreciates your participation and your feedback. We hope that you'll join us for future events. Please visit our website to learn more. That is going to conclude today's webinar presentation. Thank you so much again, Dr. Wrenn, for your wonderful webinar this afternoon. Thanks, everyone.
Thanks.